Okay, so um, last year we had actually few sessions on HEV, and this time we have tried to crammed up entire A in one session and E in one session too, so that we can reduce the time interval. So acute hepatitis E is not different with any other hepatitis, whether it is hepatitis B or A. So I will talk only about a specific thing about hepatitis E, not the overview. So briefly, I will talk about the epidemiology and HEV in pregnancy, chronic HEV and HEV vaccine. These are the specific things about hepatitis E virus. These are the four unique things, right? So epidemiology, uh, the red one you can see, the highest burden of HEV is in India, China, basically Asian countries, maximum we have. And that is less important. What is more important to know is hepatitis E. There are four genotypes primarily. Genotype 1, 2, 3, and 4. Genotype 1 and 2 behave similarly, and genotype 3 and 4 behave similarly. So there are two different type of virus which are known as HEV virus, hepatitis E virus, right? Genotype 1 and 2 is exclusively causing infection in humans. No other mammals is affected by genotype 1 and 2. India has exclusively genotype 1 only. And genotype 3 causes infection not only in humans, but pig, deer, wild boar, sheep. And remember this pig. All the piglets are almost infected by hepatitis E. And when we eat pig, so they are passed on from animal to human beings. So that is important. This genotype 3 is most common in the countries who consume lots of pork. In India, that is also one of the reason, because porks are not consumed that much. So genotype 3 is not fine, right? That is important. So genotype 1, 2, 3, 4, less to understand. Yeah, this is the overview. Genotype 1 and 2, it is primarily happening in developing countries. Most of the developing countries are eating, they are either herbivorous or they are at the max consuming chickens, fish. They are less consuming pork. But developed countries, industrialist countries, they are largely dependent for meat on pork or beef, right? Their genotype 3 and 4 is more common. So this is the general understanding. So in developing countries, genotype 1 and 2, they causes acute infection. Genotype 3 and B, they causes chronic hepatitis, chronic infection, just like chronic hepatitis B and chronic hepatitis C. अब आप लोग कंफ्यूज हो गए कि थोड़ी देर तक तो अभी चिल्ला रहे थे कि ए और ई केवल acute hepatitis करता है, और अब बता रहे हैं ई chronic भी करता है. सो जब हम लोग क्लास 1 में होते हैं ना, तो कई चीज पढ़ाई जाती है कि ये ऐसा होता है, फिर जब क्लास 2 में जाते हो पता चलता है 1 वाला बेवकूफ बना रहा था, और जब तक 10 तक पहुंचते हो तब तक पता चलता है सब बेवकूफ बना रहे थे, कुछ भी नहीं होता. तो वैसा ही है ये भी, स्टेप वाइज लर्निंग, राइट? सो जीनोटाइप 1 एंड 2 जो इंडिया में एक्सक्लूसिवली जीनोटाइप 1 होता है, इट इज टिपिकली acute icteric hepatitis. जीनोटाइप 3 एंड 4 इट इज क्रॉनिक हेपेटाइटिस बी एंड सी जैसा होता है, राइट? सो पोर्क ईटिंग से वो कंजम्पशन से ट्रांसमिट होता है. एंड जीनोटाइप 3 एंड 4 इज मोस्ट ऑफ द टाइम causing hepatitis in immunocompromised population, not in immunocompetent patient, because these are the weak viruses. So in immunocompetent patient, we can clean it, we can remove the virus. Second, by pork eating, you are not taking lots of viral load. Less amount of virus is going in because it is cooked, partially cooked. It is not raw food, no? So immunocompromised population are having genotype 3 and 4 infection. Most of the time it is transmitted through pork eating or through contaminated blood. transfusion. So organ transplant recipient group is the most common group where it is identified, particularly solid organ transplant recipient like kidney, liver, pancreas, heart, lung transplant. These patients, they have most of the time uh, genotype 3 and 4 infection. Till date, no genotype 3 or 4 infection has been reported from this country. All the infections are exclusively caused by genotype 1. They don't cause outbreak because for to happen outbreak, you have to have immunocompromised population in a group. They're always एक इधर होगा फिर एक किसी और घर में होगा तो कहां से वो एपिडेमिक नहीं हो सकता. जीनोटाइप 1 एंड 2 जो फूड एंड वाटर से ट्रांसमिट हो रहा है दैट कॉजेज एपिडेमिक. सो जब हम एचईवी की बात करते हैं ना, इट इज कॉजिंग एपिडेमिक. इट इज जीनोटाइप 1 और 2, नॉट 3 and 4, right? So immunity is strong in younger age group, so it is genotype 3 and 4 most of the time causes infection in older age group, right? Pregnant women, it is predominantly affected by genotype 1, not by genotype 3. Chronic infection is caused by genotype 3 and 4. So this is the basic two pattern of hepatitis E which we need to know. This already we have discussed. The second important thing is HEV in pregnancy. Jaundice in pregnancy is a very common condition, and it is very commonly caused by hepatitis E virus. Why it is important? We should see it. And this is also, we should know, because we all know, because this is the, it is a prestige for the country. Khuru, MS Khuru, Muhammad Sultan Khuru from Kashmir. In 1981, he reported this thing from this country. Hepatitis E virus was reported. So that is why a very added significance of this virus, which was identified, recognized by this country. So 81 means almost 45, 46 years has passed in that time. You can see here that large proportion of, he has compared the three group, pregnant women, non-pregnant women, men, and shown that who are affected. I will show this thing in a different okay. Right. So pregnant women are more likely to be affected by hepatitis E virus infection. So if community, if one is pregnant women, one is men, one is non-pregnant women, if you see that the proportion of those who are developing hepatitis is maximum 17% in pregnant women. This proportion particularly increases when it is in third trimester. So third trimester pregnant women, if she is in contact with hepatitis E virus, she may acquire and may develop icteric hepatitis. In healthy population, 5 or 6% of those who are infected with HEV will develop jaundice. 90% will not develop jaundice. But in pregnant women, almost 50-60% will develop jaundice. In normal healthy person, 0.5% of those who develop hepatitis due to HEV will develop liver failure. But in pregnancy, up to 25% of those with jaundice will develop liver failure. So that is why HEV is very important for pregnant women. So the importance is, if we have HEV positive pregnant women in our ward, that pregnant women should be isolated, so that the infection is not transmitted to other pregnant women in the same ward, because most of the time in maternity ward you have so many pregnant women. That is the application of this information, right? Because they will develop ALF, and this not only ALF, even in absence of ALF, it will also cause premature delivery or intrauterine death and other complication. Third important thing is about hepatitis E is chronic HEV, as we have discussed. This was first time reported in 2008 when I was resident doing my DM in New England Journal of Medicine. And first, just a report of 14 patients from Germany. Dr. Nasir Kamar, he reported that 14 Patient who were organ transplant recipient, kidney transplant, liver transplant, pancreas transplant, their SGOT-PT was quite high. It was not settling. So he thought that it could be because of hepatitis E and investigated his blood sample and found that they were HEV RNA positive. So since then, this entity has been established. So it is one of the very new entity. So HEV, chronic HEV is associated with immunosuppression. So viral load, risk of infection, and risk of progression to cirrhosis. Just like chronic hepatitis B, if chronic HEV is continued, it will also progress to cirrhosis. Is more in immunocompromised population. One group is HIV. And chronic HEV is treated with ribavirin and pegylated interferon. At least pegylated interferon is not very well tolerated with organ transplant recipient who are actually developing HEV, chronic HEV. So it is a very difficult situation because if you give peg interferon, it will cause organ rejection. Peg interferon, how does it work? It improves our immunity to fight against the virus. So you are inducing the immunity to fight against the virus, and same induced immunity will start fighting against the donated organ. So organ rejection will develop. That is the problem. But pegylated interferon and ribavirin, which is a toxic drug, is the drug for chronic HEV. Then HEV vaccine is another important aspect of hepatitis E because this vaccine is going to come in near future in the country. So you should know that it is going to come just like hepatitis A. HEV gene, if you see the genome, it has 4 open reading frame. These 1, 2, 3, and ORF1. This part of genome is used, the protein expressed by this part of genome is used to synthesize the vaccine, ORF1. ORF is open reading frame. So largely there are 2 types of vaccine. This was earlier used where 55 kilodalton protein antigen, it was expressed in insect cell and used, trial was done, but now it is abandoned. Now this one is going on, HEV 239. It was developed in China. This part of genome is inserted inside the E. coli bacteria. Then it is replicated, protein is harvested, purified, and used to synthesize the vaccine, right? Just like hepatitis B vaccine or any other vaccine, right? And this is the largest trial, more than 1 lakh population were included in China, where field study was done and shown that it reduces the risk of acute HEV by more than 90%. Efficacy, you can see here, it was 86, and this one you can see protective efficacy was 95%. The red line is showing the people developing hepatitis E, those who were given vaccine, and this one is the one who had not given vaccine. So you can see how much 2 graphs are different. That means this vaccine was 95% protective. And the same cohort was followed up. Yeah, you can see here that in vaccine group, out of 48,000, none developed vaccine, and placebo group 15 developed hepatitis C, right? Same study participants were followed further up to 55 months maintained. So this vaccine is really effective, but this is available only to 2 countries, China and his very close neighbor, Pakistan. No other country is having access to this vaccine. They have donated probably some trials to Bangladesh also, but no other country. And Zydus in India has made some copy paste, and they have devised their vaccine of this type by copy paste, and trial is completed. So probably that vaccine will come in India. So that is the Hecolin vaccine I just talked about. कई दफे मैं आगे निकल जाता हूँ, स्लाइड पीछे रह जाती, डोंट माइंड हाँ. So when this vaccine will come, this is the group where it will be useful. Those engaged in animal husbandry, because this vaccine is effective against genotype 3 also, not only genotype 1, but effective against genotype 3 and 4 also. So because from animal to human transmission of HEV can happen as we discussed. So in those working in high risk areas, animal husbandry, sanitation work, or sewage cleanage work, etc., those there it can be useful. Engage in catering services, student officers and soldiers, where we cannot afford their illness basically, and women of childbearing age, because as we told that in pregnancy it causes high risk of liver failure and jaundice and childhood death, and traveler to endemic country because they are susceptible to infection. So these are the group, but these are certain other group like patient with chronic liver disease can be benefited, because if chronic liver disease patient develop super added acute hepatitis E infection, he will land up into liver failure. So there it can be useful. Immunosuppressed population, as it is evident, and control hepatitis E outbreak. There also it can be used. If you know that one person is infected, you vaccinate everyone around, then epidemic will burn out. New infection will not happen. So this vaccine can be utilized in that purpose. I think in next 1 or 2 year, not two, because CDSCO has phase 2 data is completed. CDSCO has asked for phase 3 trial. So in 3 year time, phase 3 trial completed. Now it will be delayed by 4 or 5 year marketing in HEV vaccine.